Alright, so I'm going to demonstrate a head-to-toe exam for you. We're using a mannequin, obviously, and I'm going to be using the guide because I want to show you as close to perfect as I can, and I don't want to forget things as I go through, so I will be referring to the guide even though you will be doing this from memory. Okay? So for starters, what I've done is I've laid out my equipment on the bedside table, and I've laid it out in the order that I'm going to use it. I've got some alcohol wipes, which I didn't list alcohol wipes on your head-to-toe guide, but they're always good to have. Stethoscope, blood pressure cuff, thermometer. This can be either temporal or oral that you can use in the head-to-toe, pen light, and a gait belt. All right, so I'm going to back out of the room and start the exam. Hi, Mrs. Jones. My name is Diana. I'm going to be your nurse today. And the first thing that I need to do is can you please tell me your name and your date of birth? Okay, and I'm going to check your ID bracelet once I've washed my hands. Look and verified your identity. That's good. The reason I'm here right now is to do just a really quick head to toe. I'm just going to do a quick exam, check your health. Do you have any questions for me? Okay, and I'm checking the safety of the room. The bed is low and locked. Arm rails are up. I don't see any items that need to be within the patient's reach. And the floor is clear of obstructions. I also see that there's an ambu bag and some flow regulators and suction. So good. The bed's setup is all as it should be. And Mrs. Jones is looking relaxed, calm, pleasant facial expression, good nutrition, and appears to hear me okay, and speech is clear. So the next thing that I'm going to do, Mrs. Jones, is I'm going to ask you a couple of questions. First of all, can you tell me where you are right now? Okay, good. We're at the School of Nursing. And can you tell me why you're here? Okay, to have a head-to-toe exam. And what day is it today? What's the date? Okay, it is November 21st. So you've already told me who you are, so the patient is alert and oriented to time, place, person, and situation. Actually, the next thing I'm going to do is check your vital signs. I'm going to do a two-step blood pressure. You might not have had it done this way before, but it's a very accurate way of getting the blood pressure. So first, I'm just going to put this cuff on your arm. All right, and I've checked where the brachial pulse is, so the cuff is in line with that. Place my meter. Okay, the first time I do the pressure, I'm just feeling the pulse. I'm going to switch hands. Here we go. And I felt the pulse disappear around 100 millimeters mercury. All right, while we give your arm a rest, I'm going to take your pulse. All right, so your pulse was 64 and respirations were 14. I'm going to do the second step of the blood pressure now. Just wiping off my stethoscope first. And I'm going to bring your bed up a little bit so I don't have to bend over. There we go. All right. And so the pulse went away around 100, so I'm going to inflate the cuff to 130. All right, and your blood pressure was 106/70. I'm going to finish up by taking your temperature. Okay, and your temperature is 98.4. So all of your vital signs are looking good. The next thing I'm doing is checking your skin, and what I can see for starters is clean, dry, and intact. I don't see any cuts or lesions or bruises, nothing out of the ordinary. I'll be checking this throughout the rest of the exam. Taking a look at your arms right now. Whoops, I'm sorry. There we go, and the skin of the arms is intact. Also, nothing out of the ordinary. Checking temperature, and the arms are warm. Okay, I'm checking turgor at the back of the hand. Skin turgor is good. Checking the pulses. Your radial pulses are both strong. And then checking capillary refill. And capillary refill on each hand is brisk. Now I'm going to do a quick check of your strength. I'm going to have you squeeze my fingers. So I'm checking your grip. Squeeze as hard as you can. Good. And now I'm going to check the strength of your arm, your forearm. I want you to, you're holding your arm here. I'm going to pull down against you and resist me as much as you can, okay? So I'm pulling, good, full strength. Now the other way, I'm going to push up against your arm and resist my movement. Push against me. Good. And we're going to do the other side. Okay, resist. Okay, and then resist me pushing. Good. Full strength with the upper extremities. And next, I'm going to be checking your chest and your heart. Actually, before I move to that, we're going to check the eyes. So, taking a look at the eyes. Keep looking straight ahead. I'm going to sit you up a little bit more so that you can see straight ahead of you. There you go. Now keep looking straight ahead. I'm going to shine the light in each of your eyes, and don't look at the light, just keep looking straight ahead. Direct is intact. Consensual response is intact. Good. And then what I'm going to have you do is look at a point in the distance, and I'm going to bring my finger into your vision, and when I tell you, shift your gaze to my finger. Okay, look in the distance, and now look at my finger. Okay, the eyes converged and pupils constricted, so the accommodation is intact, all of Perla is intact. Let's get your sleeves back down. Now we're going to check your heart and your chest. So I'm going to lay you back down. It's a little easier to check that way. Okay. Make sure you're warm. I'm going to let your gown down just a bit. And I'm taking a look at the skin across your upper chest. Everything is intact. I don't see any masses or bulges. I'm going to take a listen to your heart, and I'm going to be taking my time just to have a good listen, so don't worry that there's anything wrong. I'm just taking my time. Listening with the diaphragm at the aortic location, second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Herbs point, third intercostal space, left sternal border. Tricuspid area, fifth intercostal space, left sternal border. And mitral area, fifth intercostal space, mid-clavicular line. Good. So S1 and S2 were clear. I didn't hear any extra heart sounds. S2 is loudest at the base, S1 loudest at the apex. I'm going to listen again with my bell. Okay, good. And the same thing, the S1 and S2 were clear, no extra heart sounds. The next thing I'm going to do is sit you up so that I can check your lungs. I'm going to let the bed back down for safety. And I can hear the lungs better with you sitting up, so that's why we're getting you up. There we go. Okay. Do that. And we'll bring your legs around and have you sit up towards me. Okay. I'm starting by checking the thorax, and the AP to lateral ratio is 1 to 2. Watching a couple of breaths. The breaths are relaxed and symmetrical. Okay, now I'm going to take a listen to your lungs, starting in the back. Each time I place down my stethoscope, take a deep breath in and out through your mouth. I'll get you to cross your arms in front of you here. And let me know if you get dizzy at any point, and we can take a break. I'm listening to the right middle lobe. Good, and the lungs were clear throughout. While you're sitting up, I'm going to take a listen in the front. So, turn this way a little bit. Starting at the apex. And one more spot on each side. Good. And the lungs are clear. So we'll set that aside and get you laid back down. There we go. Let's get you to scoot your bottom up this way. And then lay back down. There we go. Okay. Next I'm going to check your abdomen, so your stomach area. I'm just going to cover you up down here and pull up your gown so I can take a look. Make sure the panties are down low enough that I can see. And flatten that a bit. Okay. And the abdomen is flat. No masses, bulges, or lesions. Skin looks intact. I'm going to take a listen to the abdomen. Okay, and the bowel sounds are normal. Can you tell me the last time you had a bowel movement? And can you tell me what it looked like? Okay, good. And when was the last time you passed your urine? And what did that look like? Was it clear and yellow? Okay. Sounds good. Now I'm going to take a look at your legs. If you're cold, I can get you a blanket for your upper body, but I'm going to pull down your blanket for a few moments while I check your legs. The skin is clean, dry, and intact. It's warm. Even hair distribution. No pretibial edema. Checking the posterior tibial pulses. And those are 1+ bilaterally. Dorsalis pedis pulses are 2+ bilaterally. Checking capillary refill, and that is brisk. Not quite as brisk as the hands. Your feet are a little bit cold, but it's still a brisk capillary refill. And then I'm going to check your strength at your feet. Press down on my hands like you're pressing down on the gas. Good. And then pull up on my hands. Pull your feet up towards your head. Good. Full strength in the lower extremities. Checked at the feet. And the last thing we're going to do is I'm going to get you to stand up and take a few steps so that we can see how you do on your feet, how your balance is. So I'm going to get you to sit up once again. There we go. I'm going to put the gait belt on you. There we go. Bring that around. All right. And we got the tag side towards you. doing okay? All right, good. All right, and then let's get this gate belt locked. It's sliding open here. There we go. Okay, so we got the gate belt on you snug. And what I'm gonna have you do is stand up. And first we're just gonna have you stand there and see if you're steady on your feet. Ready? Okay, stand up. There you go. And now let me get you to touch each of your toes one at a time in front of you. Just toe touch. Okay, good. And then what I would do if I had someone who would walk is I would walk a few steps with the patient. So I would need to move this out of the way and say, we're going to take just a few steps that way, and I want to see how you're doing on your feet, how your balance is. If you get lightheaded at any point, let me know, and we'll just go straight back to the bed. All right, and that concludes the exam. Everything looked good. Let's take this off. Do you have any questions for me? Okay. At this point, there we go. Make sure you're back in bed and safe. All right, I'll be back soon to check on you in about half an hour. Okay. At this point, I would tell the examiner that I'm done, and I have my 3x5 card, and I'll check my 3x5 card to make sure that I didn't miss anything if I wanted to bring that. And I'm actually going to really look on my guide and make sure I didn't miss anything. And I think I got most everything. If I didn't, I'll give you guys a note. The only thing that I know that I did out of the listed order was that I forgot to do Perla. I did upper extremities first and I came back to Perla. That's okay, it was still organized in the flow of the exam. It wasn't like I got all the way to lower extremities and went back to Perla. If you did forget it, if you forget something that you're way past, work it in at the end. Make a note, work it back in. And that concludes the demonstration.